Being a student nurse can be really daunting, but I guess I decided to save lives and I'm doing it effortlessly. Hey guys, welcome to my channel. In case you're new, if you're already a subscriber, welcome back. On today's vlog, we're talking about my experience in theatre. Thank you. I spoke with my mentor about having an inside visit in theatre, as working in theatre is something I really enjoy doing, and she granted my request and went ahead to speak with the anaesthetist. While on the ward, going about my daily activities with my patients, doing my admissions, discharge, this man came to me and told me his name and introduced himself as the anaesthetist and told me he got my message from my mentor and he would like to have me in theatre. I was so glad, and you guys, you need to see the joy I had on my face that day when he told me, and he advised me about what to prepare myself to experience or to see in theatre. I went ahead to do my research. I read about the different types of anesthetics, the general anesthetics, the local anesthetics, the regional block and the spinal blocks. I even went ahead to research about the medications that they use and the different types of surgery that requires either the general, the spinal. I was really prepared and looking forward to the experience, as being an anesthetics nurse practitioner is my future dream. I went ahead to research about the methods of administration and the different medication that the anesthetics use. Some medications that the anesthetics uses are propofol, ketamine. We've got the paracetamol, the diclofenac, and ibuprofen. These are simple analgesics. We've got the lorazepam, the diazepam. These are sedations. We've got the strong opioids like the morphine, the oxycodone. We've got the weak opioids, codeine, dihydrocodeine, and tramadol. Some medications: phentermine, pregabalin, gabapentin. Most of these medications I've mentioned, they are long-acting and short-acting. You could always hear long-tech, short-tech. I'm speaking nursing now. It is important for the airway to be clear whilst the operation or the surgery is going on. That's where you get to see the eye gel or the tube. The eye gel sits in the mouth while the tube goes down to the trachea. Anesthetics monitors the ventilator machine while the procedure is going on. In a case where the patient is breathing fine, they let the patient breathe, and if they are not, they support using the ventilator machine. They administer pain relief while the procedure is going on to avoid pain. Also antibiotics when needed. This is why they work hand in hand with the surgeon and converse on what to do while the procedure is going on. They also maintain the psychological aspects of the patients, making sure they are okay, making sure their airway is clear. They put the patient to sleep using the propofol, and this decreases the blood pressure of the patient. This is why they set aside emergency medications in cases like this, and where the blood pressure drastically drops and the need to boost it up. For some surgeries, they paralyze the patients, and after the procedure, they use a constant nerve stimulator to apply shock to the patient's eyebrow to see if the patient can wake up normally or the patient needs to be reversed. The surgeries I experienced for this day were gynae, colorectal, and orthopaedic. I had such a great time in theatre, working with a great team, the anesthetics, the scrub nurse, and the ODP. I told them how I want to become an anesthetic nurse practitioner when I qualify, and they taught me all I needed to know and were ready to answer my numerous questions. They also advised that I work in emergency theatres when I graduate, that it will expose me to the field and make me more attractive anywhere I find myself, because I'll gain so much experience. Here comes the D-Day. I was walking into the female changing room where I get to change into my scrubs and get ready for theater. As part of the trust policy, you don't wear your uniform from home to avoid cross contamination.
Anything I said, I stamp on it. In a private plane, I lamp on it. Let it all, then I call me bank on it. Cause I walk around with the bank on him. Show them Gangnam Style, put the gang on him. Twist my fingers up on a bang on him. Let it all, yeah. Tobalo ko macho, yeah. Tobalo mako macho, yeah. Nobody know tomorrow. Choro ka choro. And if a boy feel macho, make him nigga red like a tomato. If him not dead, then he come out us. No go fumble.
When the patients come into the Bay Area, you do the admissions and prep them for surgery. First of all, you ask them to confirm their name and first line of address. After that, you ask for their preferred name. Go ahead by asking them some medical questions, give them VTE advice, ask them when last they had something to eat and drink. You also document that. For female below 55, you carry out a pregnancy test on them. And for those who don't want the pregnancy test, they need to sign. You put a wristband on them for identification, a white wristband. And for people with allergies, you also put a red wristband of them stating the allergies they've got. On this day, I worked with the colorectal team. Colorectal surgery deals with the repairing damage caused by colorectal diseases. The surgeries that were carried out were rectum, hemorrhoid banding, and anal fistula. It's advised that fiber food helps ease constipation, and hemorrhoids can be internal or external hemorrhoids, and they are both classified into different grades like grade 1, grade 2, grade 3, and so on. The second team I worked with were the gynae team. Gynecology surgery includes any surgical procedure that involves the organs and structure of a female pelvic region. The uterus, the cervix, the fallopian tubes, the vagina, the vulva. The third team I got to work with this day was the orthopaedics. Orthopaedics involve the injuries and diseases of your body musculoskeletal system. For the orthopedic surgery, we needed to use the X-ray. Here I am putting on my apron to prevent and protect me from radiation. Based on patient confidentiality, I won't be sharing what went on in theater and also NMC code of conduct. After the surgery, the anaesthetist bring the patient to recovery and give a handover to the nurse what went on in theater. Yeah, some equipment you can find in recovery. The recovery transfer bag, the crash trolley, emergency torch, ECG bladder scanner machine, the syringe driver machine, the blood bottles, the needles, the swabs, the saline, the cannulas, the filter needles, the cannula dressings. Oxygen. I met this student nurse who needed to achieve one of her proficiencies by teaching a fellow student how to use an equipment or anything. So she came to teach me how to use the bladder scanner. Here we are.
You see this plus coming and going.
Have you seen anything?
Yeah, this plus. You see it?
What does it mean?
This is your bladder.
Then I showed her how to use the manual blood pressure machine in a place where the electronic one doesn't work.
Watch over me, oh Lord. I cannot trust my neighbors as that day comes. As I
student nurse can be really daunting, but I signed up to save lives, and that I'm doing effortlessly. This is what the short stay unit looks like for patient who can't go home after surgery and needs to stay in hospital. I got done and headed out to catch my tram back home. Please don't forget to subscribe.